Back to our coverage right now of the coronavirus here in Connecticut. Today, Channel 3's Kara Sunland is taking your questions to an expert at Hartford Hospital to get some answers during the pandemic.
As our economy starts to open back up here in Connecticut, there are so many questions about what's safe to do and how to handle certain situations. I am joined by Dr. Henry Anyimadu. He is an infectious disease specialist at the Hospital of Central Connecticut. Thank you so much for being with us to answer our viewer questions. Could I have COVID even if I got a negative antibodies test?
Yes, but it depends on a couple of things. It depends on the test kit that was used and whether you developed antibodies in the first place. And the antibody test that we use around here, it's very good. It's about 98% specific and about 92% sensitive. Majority of people who recover from COVID-19 will have antibodies, but a small percentage may not, especially those that remain asymptomatic.
And what do you know about patients known as long haulers? What is a long hauler?
So that's long haulers are a very challenging group of patients. They are patients who continue to have symptoms of COVID-19 weeks and months into their illness. They can continue to have fevers, shortness of breath, extreme fatigue, and multiple other symptoms for a long time. It is not entirely new to COVID-19, though. About 30% or 40% of patients who recovered from the original the original SARS in 2013 had similar prolonged symptoms.
Okay.
But we don't fully understand what happens in long haulers.
Right, and some people are just still struggling. What are considered some early symptoms of COVID-19? And if you have them, are there things doctors can do to treat you early so the disease does not get too serious?
Well, the cardinal symptoms of COVID-19 include fever, shortness of breath, and cough. Some people may have loss of taste and smell, and several other symptoms which we now know of. But more data now suggests that the earlier we treat the virus, the better the response. So it's important to contact your physician as soon as you start having symptoms and get tested as soon as possible so you can be treated.
Dr. Henry Anyimadu, thank you so much for being with us and answering our viewer questions. We're going to keep doing this because we keep getting so many questions into our newsroom.